The minute you say, why do I have this problem in the first place? If you want to prevent disease, I love this expression, I'm sick and tired of feeling sick and tired, you have opened the door to integrative functional medicine. When is it time to see an integrative medicine or functional medicine clinician? If you're in the middle of a major medical emergency, having a heart attack, having a stroke, you go right into the best medical center you can go to. And you're going to get the best acute care because that's what conventional medicine is good at. But then when you come on out, you may have 7 new medications and someone just labeled you with 6 new diagnoses, diabetes, high blood pressure, high cholesterol, and so on. What happens after that when you come home and you say, how can I help myself? How can I transform my life? How can I change my lifestyle? How can I make it so I don't need so many medicines? Get my strength back, get rid of this brain fog, and so on. That's when you really want to start thinking about integrative functional medicine, because we take a holistic approach, right? We treat the whole person. It's not just one part of the body. When I came out of medical school and I got trained as an interventional cardiologist, I had drugs, many of which are great, by the way. Don't knock out all the pharmaceutical therapy. There are some really good medications. Stents, angioplasty balloons. These were my toolbox, right? I may send someone for physical therapy, occupational therapy, but my toolbox was kind of small. Becoming board certified in integrative medicine and getting trained in functional medicine, holistic medicine, my toolbox is now very big. I feel as comfortable reading an angiogram as I do prescribing supplements for lowering cholesterol naturally. So it's living in both worlds that personally has changed my life and has offered me more options for my patients. Would I benefit from coming in and seeing an integrative health provider? And I almost always say yes. And I also say don't give up your conventional provider because we can all work together and we can all talk to each other. But there's a good chance that your conventional provider may not look at your microbiome or your micronutrients or really be trained in the evidence-based use of nutrients and nutraceuticals, for example, and may not be trained in mind-body therapies. Take micronutrient deficiencies. Medical school, we're taught about the extreme end of the spectrum. Sailors on the boat, they get scurvy, their gums are bleeding. Oh, they figured out, and they had vitamin C deficiency. Rickets, a severe nutrient deficiency in vitamin D, but it's not and or. It's a spectrum because low B vitamins are linked to high homocysteine. Omega-3s are anti-inflammatory. If someone is having trouble with cardiovascular disease and they have a lot of what we call oxidative stress, there's a good chance that their antioxidants are low. Leaky gut is linked to cardiovascular disease. Gluten sensitivity, celiac disease is linked to cardiovascular disease. Rheumatologic challenges like rheumatoid arthritis and psoriasis and so on, linked to cardiovascular disease. Transcendental meditation, 48% reduction in cardiovascular events. You can't get that from a medication. For me, things like TM are a prescription, right? For some people, they need to find their purpose in life, getting a volunteer job. I remember for one lady, her life was transformed when I wrote a prescription for a small dog. You know, we're all human beings. We are whole people, body, mind, emotions, and spirit. Not all of us need the same thing, but at different points in our lives, we may need different things. The first thing you're going to notice with an integrative medicine appointment is it's long, right? So we get to ask you lots of questions, some of which you may not be so happy with, like does your stool float, or do you have food in your stool? What's your sex life like? Or do your joints hurt? Do you have brain fog? Do you sleep at night? Or do you have monkey brain? What are your core concerns? So we understand what you need right now. And that to me is a foundational difference, real understanding of who you are and what's going on with you, way beyond just looking at your blood tests. How do I find an integrative health clinician? No matter what you read and where you go, there's a lot of misinformation. You can go to the functional medicine website and find clinicians trained in functional medicine, certified in functional medicine. The American Board of Integrative Holistic Medicine's website and find clinicians that are trained. ABPS, which offers Integrative Medicine certification. And at the end of the day, you can talk to your clinicians who are taking care of you every day and say, is there someone you would refer me to who understands this world, who can guide me? Yesterday I spoke to a young man who said, I want to bring both my parents to see you. And he said, I want to bring them because they're on all these medications and I think the medications are bad. And the first thing I said to him is, do not touch your parents' medications. That's the first thing. We're happy to do a consultation. We're happy to review all the testing. We're happy to review and connect with the physician and make recommendations. We're happy to guide someone through all of these things, including lifestyle change. At the end of the day, it shouldn't be an and or. The reason we called it integrative medicine in the early days was because we wanted it to be both worlds. I want to be able to tell my patient, you need a stent, let's get the stent put in, but now we're going to change your life and do all the lifestyle therapies that are going to get to the underlying cause of why you needed that stent in the first place.